Women who are awaiting breast reconstruction, of course, want to get it done as quickly as they can. Now, typically, in my practice at least, and I think pretty much nationwide, this often involves what's called a second stage reconstruction. What do I mean by that? Well, typically at the time of mastectomy, a tissue expander is placed as part of the first stage reconstruction. And then if someone needs chemotherapy with the tissue expander in place, the chemotherapy is then given over the next 4 months or so, depending on the regimen that the patient's on. And in those women who are HER2/neu positive, they will then go on to receive Herceptin or one of the Herceptin family of biologics, usually up to 1 year's length of time. And so the answer is we first of all want you to recover from the side effects of the chemotherapy, the low white count, the low platelet count, just the fatigue of all of this. And in general, this certainly takes a good 4 to 6 weeks to get through that kind of recovery phase, if you will. Now, one quick side caveat, if you're also needing radiation therapy, then at least where I practice, we do the radiation therapy next with a tissue expander still in place, and then wait a good 6 months after the completion of the radiation therapy to then go on and do the second stage reconstruction. But for those who don't need radiation therapy in addition to the chemotherapy, typically the recovery phase from the actual chemotherapy is around 4 to 6 weeks. Generally, that adjunctive chemotherapy lasted a good 4 months or more. And so most plastic surgeons, in my experience, are then ready to go ahead and do a second stage reconstruction. That second stage reconstruction may also involve an augmentation on the other side, a lift on the other side, a variety of things. What's the bottom line? Be in good shape. Don't rush into your reconstruction. If you're receiving Herceptin, that's not a contraindication, but both physically and mentally, be prepared for the next phase of surgery. So the bottom line is that you really do well and are feeling great about yourself. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.